I put this one up. What's the other concern? Can't turn the TV on, you can't turn, what's going on? Swine flu. I mean, Sacred's got a plan for what happens here. We have now about, what, 500 and some odd cases on campus, and what's going to happen, and they have to sneeze all over your shirt and your arm, and you saw the secretary chew out one of the reporters about all of this stuff. The concerns about immunization, what are the concerns about regular immunizations? What immunizations cause? It's an interesting question. The answer to that one is, interestingly enough, no. Who said that? Autism. Immunizations cause autism, right? How many believe that?
There's been a court case about that disproved that. It was recent.
Immunizations do not cause autism. There is no data whatsoever in the thousands of studies done to suggest that immunizations cause autism.
So who brought that up?
It's an interesting issue, a very interesting question. It came up because the time of when a child is fundamentally immunized, 2 months, 4 months, 6 months primary immunizations, is around where you begin to see some developmental changes. Some people call autism. So it happened, it's sort of coincident around the same time. And some people think child was fine before, 2 months, 4 months, gets a shot, and then no longer has an expression, doesn't interact, doesn't babble, doesn't talk. There's no scientific evidence to support the association of immunizations and autism. It's tragic with many parents facing that as an issue, but as a pediatrician, my sympathy and support goes to the family, not the argument about whether the immunization, but we don't know what caused autism. Autism is a developmental constellation of a number of different kinds of, could be environmental, could be genetic, it could be a whole variety of things, but it's not from the immunization. But there's a sensitivity now. We're all going to line up. How many people got their regular flu shot? Here or here? Your nose or your arm?
Arms.
You guys could get it, a nasal shot as well. So there's sensitivity about what we're doing, because in the past there's been some problems with an immunization, and people, celebrities, sort of see some of this. I'm going to try to go a little faster, not much faster. Who said that they were the environment person in here? There were some folks interested in the environment. Yes, I'm not making it up. What's the definition of the environment? Physical, chemical, biological, and psychosocial exposures. What's an example of a chemical exposure? Sunlight, that's an example of physical exposure, but sunlight, excellent in terms of the physical environment. Not enough sunlight causes what? You know, we're vitamins. What classes are you in? How come you know the answers and they don't know the answers? Vitamin D deficiency. Because the sun converts a chemical in our skin, and we have vitamin D, which is critical for strong bones. Big teeth, strong bones. A number of kids are clearly exposed to the air. Poor quality in the air, poor quality in the water. What's cotinine? Cotinine. Anybody know what that is? What's cotinine? It's a metabolite of tobacco when you inhale it in the lung? Why do we talk about cotinine instead of cigarette smoke? Because cotinine is a measure in the body directly of the amount of exposure to cigarette smoke that you have. How can you be exposed to cigarette smoke? You can smoke it. Nobody can smoke in here. And what else can you do? Secondhand smoke. You can go to a bar. You can go to a party. And even if you're not a smoker, walk outside. The worst part is to walk in front of buildings. I used to work in these federal buildings, and it was awful. You couldn't see the entrance because it was sort of all fogged over. Smoking is a genuine concern and still is. What's the normal lead level in humans, in children? What's the normal lead level? Does everybody know what lead is? Protects Superman from kryptonite, right? I mean, you all know who Superman is, right? You don't know what Ozzy and Harry, but Superman is still. So lead is what? It's an element, right? Basic elements in batteries and all kinds of good stuff. What's the normal lead level in the human body? Well, good. I don't know if you can see it up there. 5 micrograms per deciliter, 2.5 micrograms per deciliter. What's the normal blood level? You should be used to some, even the freshmen should be used to some trick questions. The normal blood lead level in a human being is 0. 0. Why is it 0? It has no biological value whatsoever. It's only a toxin. It's only harmful. So any amount of lead, and we all have lead in us, whether it's in the water or the automobiles or whatever. There used to be some joke slides on here, but I got rid of them, I think. What's the number 1 cause of death among children? Say it louder. Car accidents. Injuries. What's an injury? It's when 2 forces come together and one gives way to the other one. What's an accident? No, there aren't any accidents. Accidents are random events that occur through without any clear rhyme, reason, responsibility. We've changed it to intentional and unintentional injuries. An intentional injury is what? Shooting somebody. Homicide. Intentional injury. An unintentional injury? Car accidents. Number 1 killer of children through age 25 in the United States. This is an example. Want to quit?
Yeah, I really need to do this, but it is 8 o'clock. Typically our meetings will probably run about an hour, maybe a little bit less in the future. But first, I'd like to thank Dr. Kessel very much for coming.